Okay, guys, what if I told you that a significant number of people who had treatment for a urinary tract infection have continued pain in their pelvis, pain in their bladder, pain down there, and this is a super common problem. Let's talk about why. Hey guys, Dr. Segal here. So the question is, UTI is gone? Yeah, right. Why do I still have symptoms? So we see this very frequently where individuals have gotten a course for a urinary tract infection and they still have some of the symptoms associated with it, whether it's burning frequency, pain down there, etc., and they're scratching their head as to why are they still having the symptoms. And so what I want to do is just give you a few ideas as to why you may still be having symptoms after treatment for a urinary tract infection. And at the end, stay tuned because I want to talk to you about probably a lesser thought about reason why individuals still have discomfort that is usually self-resolved after a urinary tract infection. So I'll tell you that at the end. So one of the first reasons why people have persistent discomfort, persistent symptoms after a urinary tract infection treatment is because of incomplete treatment. So they'll get an antibiotic course, they'll start to feel better, and they think they're out of the woods. And then you give it another day or two after the antibiotics are done, and they have recurrent symptoms. So most antibiotic courses that primary care doctors and urologists choose are sufficient to treat urinary tract infections, but there are circumstances where we call them complicated urinary tract infection. If there's a stone in the urinary tract, other anatomic abnormality, swelling of the urinary tract, sometimes in men, all these things sometimes will require a longer duration of therapy. So it's very possible that if you got better and then you get worse a couple days after antibiotics, that you had incomplete treatment. Now, there is the circumstance too where you never really feel better. So you take the antibiotics and you're still feeling like crap and you don't know why. And one of the reasons why it's very common for prescribers, and this isn't a wrong thing to do, but it's very common for them to give antibiotics just when somebody calls with symptoms without a culture result. And this can sometimes be a very good thing, right? Because if somebody's having symptoms and you give them antibiotics quickly, then their symptoms are going to go away more likely, more quickly, and less likely to progress to a serious urinary tract infections. So we do this all the time. But the problem is we pick antibiotics that typically will kill bacteria in the urinary tract. There are always circumstances, or there are very frequently circumstances where there are resistant bacteria in the urinary tract that the antibiotic we choose will not kill that bacteria. So if they start you on an antibiotic and you're not getting better, and from the get-go you haven't gotten better, it's very possible that it's not the correct antibiotic. One of the things that we think is really important, if able to, now this isn't always possible, but if able to, is to get a culture before you start antibiotics, because if we get the culture, we start you on the antibiotics, then we'll have the culture result back sometimes as soon as 24 hours, depending on the kind of culture, and then we can change the antibiotic if necessary. If not, then we're playing a little bit of a guessing game. So that's the second possibility, wrong antibiotic. The other possibility is that a new bacteria is there, right? So if we gave you the right antibiotic and you're getting urinary tract infections frequently, presumably there's something about you that's causing you to get urinary tract infections. So if we're giving you an antibiotic that's going to kill one bacteria, it's not going to kill all of them. And so you can get what's called a super infection, right? So you get a urinary tract infection, it's treated, but in the midst of that, you're kind of a UTI factory, so you're getting a different bacteria that's not killed by the initial antibiotic because it's a totally different type of bug in there. Again, a culture can help us figure that out. Do you have a new bacteria in the urinary tract causing your symptoms? Sometimes there are structural changes in your urinary tract that cause a mimic in the symptoms that are associated with the urinary tract infection, but they're not a urinary tract infection at all. So oftentimes when patients have what we call lower urinary tract infections, frequency, urgency, pain down there, we'll presume it's a urinary tract infection. Again, not wrong, and we'll give them antibiotics because we think we're going to get them better. and they just don't get better, and it doesn't make sense, and we've tried a number of different courses. Oftentimes what we'll do in that situation, or primary care doctors will send us over for, is to actually look in their bladder with a camera, because we want to go on a little bit of an expedition to see if there is something in the bladder that's causing the symptoms that's not related to the urinary tract infection. Examples are sometimes you'll see a little bladder tumor, unlikely but possible, growing from the side of the bladder. Sometimes you'll see a stone sitting here on the bottom of the bladder, and that's going to cause persistent irritation of the lining of the bladder, making people feel like they got to go all the time, also collecting bacteria for what it's worth. Sometimes somebody that's not getting better from a urinary tract infection, they'll have what I like to call like an outpouching of the bladder. So they'll have like a pocket of the bladder that's collecting urine. And that urine, it's hard to get to the outside world because this pocket of bladder doesn't have muscle to squeeze the urine out. It's called a diverticulum. We can see that on a scope as well. And if we see that, individuals sometimes won't be able to clear that urinary tract infection until we fix that or figure out how to deal with that surgically. So those are some other reasons why patients will have persistent symptoms despite an antibiotic course. There are other conditions in the bladder that you can't necessarily see with a scope. There's something called interstitial cystitis, which is a inflammation of the lining of the bladder, kind of a perpetual inflammation of the lining of the bladder. And I've seen people where they've gotten they have a history of interstitial cystitis, they've gotten a urinary tract infection. It kind of makes everything worse, and that inflammation will, that interstitial cystitis will already be present, so they'll have some chronic discomfort down there. And one of the other reasons is that it may not be a urinary cause. So we treat them for a urinary tract infection. They still have some discomfort down there. They feel like they're mostly better, but they're still having some symptoms. And we've looked in their bladder. We've really done an extensive workup. Sometimes we'll even get imaging studies and we'll say, you know what? The urinary system looks pretty darn good. And then we get help from our OBGYN colleagues, GI colleagues, to see if there's something in kind of one of those systems that's causing symptoms that will often mimic urinary tract symptoms. So those are all reasons why people might have persistent UTI type symptoms despite antibiotic therapy, whether the antibiotic is appropriate or not. And then, so this is my final pearl I want to tell you, and I see this all the time, and it's something that I just noticed in my practice the past 10 years, is that I think there's this phenomenon called post-UTI inflammation, okay? When you have a bacteria in the urinary tract and it's hanging out somewhere in the urinary tract, antibiotics work by killing this bacteria, but they work in conjunction with your body inducing an immune reaction against that bacteria. And it'll help kill that bacteria with the help of the antibiotics. But that also makes it so that the lining of the bladder is going to be really inflamed. And that's uncomfortable. That can mimic the symptoms of a urinary tract infection. Anybody that's had a deep cut or a scar know that inflammation in your skin can last for quite some time. So I've seen some people where we've done a thorough workup, haven't found anything, and we just kind of put them on some non-steroidal anti-inflammatory drugs or some other urinary analgesics to help with discomfort down there. And then with time, their symptoms get better. And we kind of chalk that up to inflammation in the lower urinary tract, which has a good prognosis. With time, it tends to get better. So I hope that's helpful to you guys. I hope that answers some questions as to why you may be having persistent urinary tract infection type symptoms despite getting antibiotics or other therapies. Thank you so much for listening. We really appreciate it. If you don't mind, please subscribe to our channel. Thank you so much.